Good afternoon, everybody. Let me take this pleasure to thank everybody who have welcomed all of us here on the occasion. I would also like to extend my greetings to everybody who have been a part of this convocation. Dr. Usha Manjunath, Director of IIHMR, uh, Professor Dr. Sadgopan, who gave us a good talk on as a special invitee. Dr. Srivastava, who advisor quality improvement, National Health Systems Research, and Dr. Kirti Uday, who has actually invited me for this talk. So I take this opportunity to congratulate all the students who have passed out today of the IHMR batch of 2019-2021. All the 55 students today who are going to pass out from this batch, I wish you all the best as you move into your careers. This is a proud moment for you all. And I would also take this opportunity to congratulate all the parents and the teachers who have spent their valuable hours to ensure that the students and their uh, uh, students and their children are passing out with bright colors. I would also take this opportunity to tell you a few things of my learnings in my career. I have humbly believed in all the values which have been just spoken by the eminent speakers just now. And I also believe that one of the most important things as you move into your career is to not forget your past. You're moving out from a very rich institute, IHMR. I have worked with a lot of colleagues of IHMR in my career in the last 20 years, and I can say you guys are all proud and should be very proud as you move on in your career. Be proud of your alma mater, be proud of your colleagues, and see to it that you support each one to take the industry to the next level. Healthcare is a very challenging profession. Healthcare industry itself is a very challenging profession, and being in this industry, we all know that this is a mix of immense knowledgeable and intelligent people like doctors. We have a lot of innovation and technology coming in, and we have the best of technology which even identifies tumors of as small as 2 millimeters and gives precision treatments with lasers and radiation. We also have a lot of emotions in this industry, especially the hospital industry. There are emotions of patients, emotions of relatives, there are emotions from our doctors, consultants, nursing staff, and you are going to face all these challenges as you move on. One of the most important things we should remember is that do not get scared of challenges. Move ahead, take decisions. Dr. Srivastava just mentioned about how important it is to move ahead and take decisions. Do not procrastinate. Do not hold on. There could be times when your decision may be wrong. Do not forget that at least you took a decision. You are going to move into managerial positions. You are going to move into leadership roles as you move forward, and all these things would help you evolve as a much better leader. Do not get scared of failures in life. Failure is a part of our life. Failure is actually unfinished success for all of us. Failure is something which we should use as a stepping stone. We read all about it, but actually we need to impart and involve this in our day-to-day work atmosphere. It is necessary as you move into your careers that you do not forget the basic values and ethics which you have learned from your institution and from your parents and teachers. It is important that you ensure that you impart these values in your day-to-day life, walk the talk as you move on in your career. And there could be times you would be faced with dilemmas. You could be faced with ethical dilemmas. You would be faced with dilemmas to taking a decision. Keep the interest of the organization, keep the interest of the patient, or keep the interest of the country first. There are times when you realize that you are unable to take a decision. Feel free to ask superiors, feel free to take advice from colleagues. Do not hesitate. Nobody will laugh, nobody will feel bad. I can tell you at that moment somebody will laugh, but you will be at least getting a knowledge where you can take a very well thought decision. We are going to be entrusted with this industry, where we have to take this industry to the next level. The COVID pandemic in the last 1.5 years has taught us how fragile our industry has been. we are weak. We could not sometimes sustain it. I also understand that all of it was because of the tremendous load of patients that suddenly came in, and we were completely unprepared for it. But I can say one thing: I and my team also felt that this was an opportunity. The COVID pandemic gave us an opportunity to understand and realize that healthcare, there is a lot to be done in our country. This is an opportunity which will open up new frontiers for all of you, new options for all of you in this industry. Some of you will enter into healthcare IT, some of you will move into healthcare management, some of you may have your own startups going forward, some of healthcare startups, some of you may even move into policy decision making in the government and in the industry body. Ensure that you have only one thing in mind: to take healthcare to the next level. As I talk about healthcare, I also know that there is a vast gap in healthcare across South India, Western India, Northern India, and the eastern part of this country. We have to see to it that healthcare, as we move forward, reaches, becomes more affordable, accessible, and available to all. This is our biggest challenge. Whichever part of healthcare you are in, healthcare pharma, healthcare IT, health hospital management, whichever part, you have to ensure that the healthcare moves to the next level. And our success will not be defined by the number of hospitals that we set up, or by the number of, or by the high-end work that we do. That would still continue to happen, and that would still continue to happen in big areas. But our success would be defined by how much our poor, I would say, not how our poor go to private hospitals, but when the rich start going to our public hospitals. So many of you would be entering into the public infrastructure part and ensuring that we take our public infrastructure to the next level, because private hospitals would always be coming at a cost. There would be a cost associated to healthcare because of technological upgradations, because of higher cost of inflation, as well as expenses which are going up on a day-to-day basis. But we can ensure that we make healthcare available in public hospitals too, which will ensure that not everybody has to come to a private hospital to ensure that they get the best of healthcare. They should move to a private hospital only if it is not available at a public hospital. But if we can take the level of our public hospitals to the next level, I'm sure all of us and the country and our citizens would benefit from this. I also believe that healthcare is going to be the decade for us. This next decade would be the decade of healthcare, and you are at the right moment moving into this industry. This decade of healthcare, I believe, is going to define how the health of this nation would be moving forward. I also see, sitting in a hospital today and running and talking with industry leaders in Mumbai and across the country, I see one thing which I see as a definite change. That is a drastic increase in awareness about each individual's health. People are becoming health aware. There was a time when I know public as well as the citizens used to believe that healthcare is an expense. Today, healthcare is being seen as an investment to ensure that we remain healthy. I think Dr. Srivastava just mentioned about it, and I think that is something which is very, very important for us. Take care of your health and ensure that you remain healthy. If you are healthy, you can take care of your loved ones, you can take care of your jobs. But this awakening is also coming in the public mood, and I'm telling you, this is an opportunity for all of us. I also see a large opportunity for insurance. Healthcare insurance in this country is going to pick up in the coming years. I myself see patients who used to have a minimum of 2 lakh, 3 lakh coverages are now moving into expanding and taking 10 lakh, 15 lakh policies. That's because people are aware now that healthcare is costly. But I think our job would be, as we move into the industry, to make it as affordable as possible. Ensure that the costs are in control, so that everybody cannot afford a 15 lakh policy. People who cannot afford have to get it at affordable rates. And that is going to be a big challenge as we move into this industry. But I see great opportunities for you as students as you move on. As we also move on from here, I have to tell you about two or three things which have been learnings in my life. Take challenges. You will be faced with a lot of challenges. Do not shy away from them. Do not pass them on to somebody. If you are in a position to make a difference and you are in a position to take a decision, kindly do it. Move ahead. Take that call. The second would be to keep your eyes and ears open for learning all the time. Learning is an integral part of our life. Every learning, whether good or bad, gives us an experience. And that experience is going to define our future decision making. That experience is going to define us. We have to move on. We have to take challenges and learn every day. Also, do not shy away. I just repeated it just some time back, that do not shy away from asking. I would say those who ask and those who learn are going to be the wisest people and not to be treated as fools. There are people who would laugh, but I'm telling you, people who have been laughed upon earlier, 10 years later, people actually congratulate them and say, wow, this is what you could do. Experience from my life I would like to share about an event which happened in the pandemic last year, when we were faced with the daunting task of doing and setting up the hospital infrastructure back. We were treating COVID patients, but most of our non-COVID work had gone down. And we took a decision to see to it that none of our employees lost their jobs. We took a decision that we will ourselves take the big pay cuts to ensure that our employees and our staff do not lose. And I can tell you, the hospital has just got a rebound after that. We ensured that none of our staff lost their jobs, and we were able to see to it that their morale was boosted. Those employees today are working with double the energy, double the determination. And I can tell you, this is what you will have to do as you move in your career. Stand by your team, stand by your colleagues. But yes, obviously, do what is right. Do not bend down. You do not have to compromise on your ethics, on your values as you move on into your career. The last thing which I would like to tell the team is, remember to make a difference in your life, in everybody whom you touch in your careers. We have made a difference in the last 20 years in my career, and I'm proud to say that I'm happy because I have a peaceful sleep because of these reasons. Do that, create value, become better human beings, and see to it that you make your institution proud wherever you go. All the best to all of you. Thank you for this invite. Thank you.